point here, and this is just an example. I've had 6 shoulder operations.
6?
6.
You are very brave.
Metal in this one, some metal in this one, and you get to the 6th one and he says, but you've got to remember, Brett, you've got some arthritis in there. And it was just as if the door was being closed and get on with it. Well, what is the point of having those 6 operations if he's going to tell you that at the end? So I've still got the same, the mechanical movement, the pain that goes with it.
I do not know what sort of surgical correction has been done.
The rotator cuff.
You often hear people go for a fancy keyhole surgery. Footballers and rugby players, they had the meniscus injuries. The nicest way they put it across is, oh, I just went in, had a quick wash and clean and tidied up. Sounds great, right? But meniscus is the shock absorber of the knee joint. Even if they trim 1% of the meniscus, they're taking 1% away. That means you are 5% faster in developing the joint arthritis because they're taking the shock absorber away.
But they don't tell you that on operation 1, do they?
They started to say recently, a keyhole procedure is not possibly available for everybody unless you are an elite athlete. But look at that elite athlete. Once he finished with his elitism, he or she is going to have the arthritis. And that's when we need to treat things with arthritic care. And even in that knee joint perspective, we have more advanced therapeutic measures now. People do not have to have joint replacements anymore. There are more alternative therapies available. Gel injection and even the liquid form of implant is available. Arthritis need not to be, okay, that's it, my life is over. But understanding, the doctors do say that because it's from a doctor's perspective, that's all they can do. If a physiotherapist has said that, then I'll be very crossed. Because
but why are they not singing from the same hymn sheet?
Because again, the availability in the current healthcare system. A doctor to see a physiotherapist takes 6 weeks time, and then the physiotherapist to physiotherapist another 3 weeks time, and if anything more than that. By this time, we are frustrated. It's already 3-4 months gone, and we are still in the same state, and we will start to buy in. Maybe it is the way. Not really. And we are trying. We are trying to associate with some of the shoulder surgeons. So they know that it should not be doing the second surgery. That's a maximum 1 surgery. That's too much of scars in that shoulder, poor shoulders. And I hope that you have a good strength.
A lot of it is mind over matter, and think, well, that's hurting, and this is hurting, and that's hurting, and think, where's it going to stop?
Exactly. It's not necessarily always mind over matter. Yes, to some extent it is. Structurally. We always have some changes. We have a full growth. As a human being, we finish our growth at 25 years, and then we have a plateau at 30. And then we have all changes happen, but that changes does not mean symptoms. That blue bell curve does not mean pain, stiffness. We all have changes. That's inevitable. It's possible to be symptom-free despite of the normal changes within the joints structure. Whether we want to have a clear spine, or whether I would be able to do 25 miles of walking, or I want to do the marathon, I want to do cycle 50 miles, I can bend down, play with my children or grandchildren, I can kick the ball, I can do some gardening, I can go to my allotment, I just want to do some more hands-on things. Well, if that is what we wanted, it is possible. Even with the diagnosis of arthritis. So arthritis is not, as I said, is not the end of the journey.
But that's the thought you walked out with when the guys just told you that is what we can't help you anymore, you just got to get on with this. What is it? What do we have to get on with?
Correct. And how many people stops doing because the doctor said nothing can be done. And to get to see a doctor 3 weeks, get to see a physio from there another 8 weeks. And we have had a lot of people come from Abasoc to have the knee joint osteoarthritic management. 2 hours for a half-an-hour physiotherapy session. Abasoc. But he defied the surgery though. He wrote the letter to his surgeon to say, I am not having the surgery.